Sexually Transmitted Disease Risk in the Geriatric Population by Lillian A., Milan J., and Jessica O.
Sexually transmitted infections and disease rates have been increasing in the older adult population over the last few decades. During a physical assessment, sexual health is not prioritized in the assessment process, and it can often be omitted entirely. A stigma has developed around talking with older adults about their sexual health, and therefore proper sexual health education is extremely poor, and this has resulted, in part, to the increase in STIs and STDs among older adults. We gathered this information from peer-reviewed articles, and it is used to seek improved ways to inform the older adult of proper sexual health education and alert medical staff to prioritize sexual health questioning during the physical assessment. Our research was gathered with use of online databases, including peer-reviewed articles and previously conducted case studies. We learned from this research that the older adult population is undereducated in sexual health, and there is also a pattern of lack of inclusivity in the topic of sexual health in the older adult population. It is not prioritized in the physical health assessment as it would be of a younger person. We concluded that the sexual health assessment should be a priority when assessing the older adult. The older adult lacks education and inclusivity when it comes to the field of sexual health. Improved tactics of screening and education will be a positive factor to help decrease the rates of STIs and STDs in the older adult population. Older adults have several difficulties with openly discussing sexual health with their medical providers. There is a stigma surrounding the older adult population and their sexual health that has led to unsafe practices and the increased rates of STIs and STDs. First, there is an enormous stereotype that older people do not have sex like younger adults. The National Council on Aging conducted a study, and nearly half of all Americans 60 years and older have sex at least once a month, and half of those wanted sex more frequently. There is also an assumed stereotype that just because someone is quote-unquote old, they are simply not able to have sex. Because of this stereotyping, older adults can feel that they are discriminated against, which makes it even more difficult to be open and honest with their current sexual health. The older adult population that we recognize at this time were raised in an era of keeping sexual matters extremely private and continue with that same mindset even with medical providers. Because of these, the implications that are occurring in part from the stigma are now very poor sexual health education and lack of communication between patient and provider. We are seeing the uptrend in current STI and STD rates in the older adult population. Research shows that older adults lack proper sexual health education. Since sexual health and wellness is not prioritized in the physical assessment and can sometimes be omitted entirely, the older adults are not receiving the appropriate education they need to practice safe sex. This can lead to misconceptions and total lack of knowledge surrounding STIs and STDs. To prevent continued poor communication between medical staff and patient, providers must be more comfortable with openly discussing the older adults' sexual practices. Older adults will most likely not bring up sexual wellness while with the provider, so the provider needs to create a safe space for the patient to discuss their current sexual practices and questions that they may have. Prioritizing sexual health and screening for sexual health implications in the older adult health assessment is key to providing accurate information, ensuring safe sexual practices, and to assess for any current misinformation and miseducation.
Geriatric STD statistics is a hot topic. The Center for Disease Control and Prevention states that STDs have more than doubled in the past 10 years among the U.S. older population, patients aging from 65 years and up. There are multiple reasons for this, one being misconceptions from both the patient and healthcare providers, two as under or miseducation, three is there are a lot of widowed partners lately, and older men are increasing their number of partners as a result of that. Older patients have reported that they are less likely to use condoms during sex. They did not see the need for it or believe that they are exempt and that STDs was a younger patient issue or a younger person's issue. They are more likely to engage in risky behavior as a result, again, of misinformation, miseducation, misconceptions, and also feeling as if they don't have the space to communicate about intimate details. We will now explore the ways to prevent STDs. STD prevention is universal despite us talking about older adults. The number one way to prevent STDs is through abstinence. Abstinence means not having oral, vaginal, or anal sex. We can also give the education of condom use. That is another way to prevent certain STDs. Condom use has shown to be a knowledge gap amongst the older population. The National Survey of Sexual Health and Behavior did a study on age group 50 and older, and it revealed that less than a quarter of older adults reported the use of condom use. Despite their knowledge of their current sexual partner having a known STI at the last sexual encounter or the last time of intercourse. To note, condoms cannot prevent all STDs. Certain STDs, such as herpes or HPV, can still be contacted through skin-to-skin contact. Again, another way of prevention is continuous STD or STI education. We can also decrease the amount of sexual partners that we have. Inside of decreasing the amount of sexual partners, opening that line of communication and having that talk and explaining that it is important for both parties to have education and also know their status, get tested together. You can make statements like, I care about you and your health status. We can do this together. Mutual monogamy is another way you and your partner can agree to explicitly date one another and also continue to have frequent testing. Aside from sexual health issues, the geriatric population faces other unique challenges that can also be linked to the sexually transmitted infections, increasing rise amongst this population. This is a vulnerable population due to physical decline, and they often fear going to the hospital or seeking medical care because it causes functional decline. Patients 65 and older are less likely to be back at baseline compared to younger adults. So inside of that, these geriatric considerations can be linked to the reasons why STI prevention or reporting and education is low amongst this population. They are less likely to seek medical help because of the inability to rebound. They are less likely to be resilient in comparison to a younger patient after hospitalization. They have a fear of losing their independence. After hospitalization, many older patients are sent to a rehab center, sent home with home health, or sent to a assisted living facility. There's also less access in healthcare for this population due to lack of resources, transportation, fear, misconceptions again. And this population also has general decreased cognition. It's another functional decline that can come with age. This population may have a decreased understanding of information given to them during hospital visits or visits with their primary care provider. Having decreased cognition, again, relates to the STI prevention because medical providers may not be using the correct tools to educate, assess, or overall advise this patient group. Again, these geriatric considerations are unique considerations that this population deals with, but they also can relate to the reason of the underreporting, undereducation, and misconceptions of the patients that are 65 and up.
A tool that providers and medical staff can use to help assess sexual health and needs is the PLISSIT model. PLISSIT is an acronym that means permission, limited information, specific suggestions, and intensive therapy. This model helps to introduce sexual health into a clinical conversation and advise helpful treatment for problems that the patient may have. The steps used in this model are: number one, the provider creates a safe space for the patient to bring up sexual health concerns or to speak about their current sex life. Providers should use open-ended questions such as, is there anything about your sexual health that you would like to discuss? Number two, once a concern has been identified, the provider can offer targeted information, including potential causes of the symptoms. Number three, the provider can offer specific suggestions to address the current problem and introduce a plan of care if the problem is not corrected with the current suggestions. And number four, referrals can also be made to sexual health specialists such as sex therapists to provide a more specific and comprehensive therapy for the older adult.
Something to consider when working with a different population is their health differences. Geriatric health differences include the fact that some symptoms may present differently. They have more frail skin, so cuts and open wounds are more prone to infection. There's an overall health decline that's related to age. The immune system starts to wear down. They can't fight off infections as well, so they get sick a lot easier. There are decreased vaginal secretions, so when there's sexual intercourse, it's a bit drier and it can cause abrasions, which can open ways for infection to come in. There's also decreased cognition that comes with age, and that can be a big issue when it comes to recognizing symptoms early on, seeking treatment, being able to properly tell the doctor what's going on. And then there's decreased sensation. This can bring on a number of issues, including not being able to feel what's going on, really. Some symptoms include burning with urination or pelvic pain. Some patients may not be able to feel that due to decreased sensation. There's declining eyesight. So some patients might not be able to see a difference in if their urine looks different, if it has blood in it, or if there's pus or something coming out like that. So they may not tell that there's anything going on with them, really. And then there's the immunology decline. So that goes back to the overall health decline that's related to age, but on a cellular level, the geriatric immune system is not as good or as protective against new diseases as younger populations. A good way to prevent STD transmission in the geriatric population is patient education. Patient education would include having a safe environment to openly communicate in, have conversations with providers, regular screening for STDs and STIs if sexually This could also include self-education, so like pamphlets, helpful little tips and tricks on how to stay safe when sexually active, and where to find help if they need it. And then also basic knowledge about STDs and STIs and how they present in the geriatric population would all be helpful in preventing and early catching of STDs and STIs. Another way to prevent STD and STI transmission in the geriatric population is helping healthcare providers actually consider that the geriatric population is sexually active. A lot of healthcare providers tend to miss that part of a regular checkup because they think that maybe after 60 years of age they're not sexually active, but patients still are. So what can healthcare providers do differently? Well, they can initiate the conversation, because sometimes patients don't want to start off the conversation by saying, yeah, I'm sexually active and here's how I'm doing it. They can create a safe space for patients. They can utilize standardized screening tools like we showed up above. They can acknowledge personal misconceptions or biases. They can continue to educate older adults and properly educate older adults on how to get things done, and that is seen in our patient education slide. And then they can make the patient feel like they have a partner. So not necessarily that you're their doctor, but you're a confidant. You're there to help them, not judge them. Those are all really good things that healthcare providers can take into consideration to help prevent this spread.